Okay, we'll try this again. Good morning. So we're going to go ahead and get started because I'm very respectful of the fact that you all are on a timeline, as important as this topic is. First of all, welcome. This is one of the MWR Family Services Program seminars. And today our topic is going to be Social Security and you. That's the most important thing. We all know how it applies to you. And we're very lucky that we're going to have as our speaker a Social Security Administration representative. She's from the Hamilton Road office?
Yes.
Hamilton Road office. This is Lynette Johnson. So she'll be talking to us. Before that, just a couple of quick reminders about things. Please silence your phones so that we don't have any unexpected interruptions. And then just a couple of MWR notes that I want to give you. For those of you that don't know, the Admiral's Cup is going on, and it'll be going on until the 25th of October, so get that team together and come participate and play. There's a 5K powder blast that is, that's why I just said powder blast. Did I say it wrong? But let's go with powder blast. And that'll be on the 11th of July. Social hour is starting at the golf course at the Eagle Eye on Friday evening, so take a look on your way out if you're looking for some place to socialize with your friends and coworkers. And then lastly, there is an intermediate golf clinic that will be starting 18 July through August 8th. So take a look at the webpage. I will let you know that this is streaming. It's being recorded. And it will also be available with the slides and all of the links for the different documents that we're going to talk about today. That'll all be available on the MWR webpage. Takes about 3 or 4 days. So if someone that you know didn't get to join us today and you feel that they would benefit from the information, please let them know that they can access it even after the fact, okay? So without further ado, I'm going to introduce Lynette and let her get started and talk to us about Social Security and how it applies, when to take it, how it works with Medicare, what else?
Yeah, just a quick overview.
All of those different things. So let's welcome our Social Security representative.
Okay. Good morning. Can everyone hear me? Can you hear me in the back? Okay. With the mic here. Yeah. Okay. Okay, again, my name is Lynette Johnson. I work for Social Security Administration. I've been there for a little over 20 years. I work for the Hamilton Road office. First of all, I want to know who all here that's going to be retiring within the next year or two? Oh, wonderful. It's awesome. And who wants to retire within the next year? I wish they could retire in the next year or two. Okay. So what we're going to do, we're just going to go over, and I'm saying we because I'm so used to having the other person here with me who's not here now. So, but I'm going to go over just a quick basic overview of what Social Security information, you would need when you get ready to retire or plan to retire, okay? And then towards the end, at the end of the PowerPoint, then we'll have questions that I can answer to the best of my ability. If there's questions that I can't answer, you write down your information and I will, contact you and give you the answers that you need, okay? Okay, so we're going to do just an overview of the benefits, how work affect your benefits, filing for benefits, Medicare, and touch on My Social Security account. Who all has a My Social Security account? Great. If you don't have it, you definitely want to sign up for it because it's awesome. You can go in and you can get all your information. You definitely want to sign up for it if you don't have that. Okay. How do you qualify for retirement benefits? Okay. By earning credits when you work and pay Social Security taxes, you need 40 credits, and you must be at least 62 years old. 40 credits or quarters. Each, for 2019, each 1,360 in earnings give you 1 credit or 1 quarter. You earn a maximum of 4 credits or 4 quarters per year. Now, for 2019, 4 credits will add up to $5,440. As long as you earn that amount in the year, you have your 4 quarters. It doesn't matter if you earn that in January, February, March, or half a year. As long as you earn it, we spread those quarters out. So by the end of the year, you still will have those 4 quarters. So you don't necessarily have to work the whole year to earn the $5,440 as long as you earn it within that year. Okay, how Social Security determine your benefits? Okay, the first step is your wages are adjusted for changes of wage level over time, basically because we make more now than we did when we were 17 or 18 or 19. So they have to adjust it based on your wage changes. Earnings for the highest 35 years, step 2, are average divided by the number of months in 35 years, which give you an average index monthly earnings, what we call AMI. Okay, so they take your highest 35 years, not necessarily consecutive years, over time, 35 years. Then step 3, the SSA formula is applied to the AMI and to produce the primary insurance amount. Now, the primary insurance amount is the benefit payable to you at your full retirement age. Of course, full retirement age has changed depending on when you were born, but as of this year, people who are turning 66, that would be their full retirement age. So there's also a good information online. It's called, give you that information here. Okay. As a matter of fact, I'll get back to you guys on that because I have that in my notes. Okay. Now, if you work less than 35 years, what they do is the years that you do not work, they put zeros in those years, and they average out the 35 years based on the zeros. Still, you'll average out to the same thing, but they, again, they take your highest years, so not consecutive years for that. Okay. The higher your average lifetime Social Security earnings, the higher monthly benefits you get. So the longer you work, the higher your benefits. Of course, your benefits would be larger than if you work less years. This right here is what we call a benefit matrix. A benefit matrix basically give you, as of right now, your earnings, current earnings. It can give you the amount that you're entitled to at your full retirement age. The benefit matrix can start you from age 62, and it tells you how much you're entitled to at 62 all the way up to your full retirement age. And it also would give you information on if you wait to after your full retirement age for delayed retirement credits. Now, the benefit matrix, we normally, this is a tool we use all the time in Social Security, okay? When we'll be coming soon when Michelle scheduled that for a 101 visit, and you definitely want to sign up for that because we can pull that right up on the computer and give you information on how much you're entitled to at 62, 65, and delay retirement credits after that. Okay, so with this chart right here, and I know you can't see it real good, but this basically tells you your reduction. The earlier you take your benefits, of course, the more reduction you're going to get. So just assume that you're getting $1,000 a month for your Social Security. If you take that at age 62, you were born between 1943 and 1954. That means your full retirement age is 66, so you're taking it at a 25% reduction. If you were born in 1955, your full retirement is 66 in 2 months. So you're taking it at a 25.83 reduction. Then it goes on to 1956, you're looking at 26.67 reduction, 1957, 27.5, 1958, 28.33, 59, 29.17. Now, if you take it 1960, if you're born 1960, then your full retirement age is 67. 1960 or later, you have to wait all the way to 67 for full retirement. But you can still take it at 62, but if you do, you're looking at a 30% reduction. Okay? Now, some of the reasons that some people may have to take their retirement early, everyone is in different situations. You may have poor health, or if you have a short life expectancy, you may be out of work and need income right now, so that's some of the reasons why some people may have to take it early. If you're in good health, you may want to wait longer to take it so you can get a higher return, a higher benefit. Okay, now there's a estimator that who all has the SSA, it's online now, and they can pull up their My SSA account. There is an estimator, and it's based on actual Social Security earnings record. You can use the retirement estimator, which is really good. If you have enough Social Security credits at the time, you'll be able to pull that up and get the information that you need now. At the time you qualify for benefits, and if you are not currently receiving benefits on your Social Security, if you're not waiting for a decision about your application for benefits, if you are not age 62 or older, then you can't use that. In order for you to use it, that you have to be at least 62, have enough current quarters, and then you can use that estimator, and they give you a lot of information on that. Now, if you're eligible for a pension that's not covered by Social Security, which would be OPERS, CSRS, public employees retirement, silver service. I don't know if we have any silver service in here, but it would not give you a true estimator because, of course, if you qualify for silver service, then you're subject to what they call the windfall elimination provision, okay, which we'll talk about that a little later. Okay, there is an earnings limit. If you decide to file before your full retirement age, under full retirement age this year for 2019, your earnings limit is $17,640 for the year. Anytime you go over that amount, Social Security withhold $1 for every $2 you're over, okay? Full year retirement age, so the year you turn full retirement, this year if you're turning 66, then you have an earnings limit that's over $46,920 a year before the month of your full retirement. If you're over that amount, then Social Security withhold $1 for every $3 you're over. Now, the month of your full retirement or above, you have no limit. You can make whatever you want. So the month you turn 66 this year, who's ever turning 66, you can work and you can make whatever you want, and you also can collect your Social Security, okay, without any penalty or anything, okay? And also, a little note here, if some of your retirement benefits are withheld because of your earnings, your benefit will be increased starting your full retirement age to take into account for months in which benefits were withheld. Income that count as earnings. That would be gross wages from employment and or net earnings from self-employment. Income does not count as earnings. Inherited payments, pensions, income investments, interest, dividends, capital gains, other sources. So in other words, that $17,640, that's only wages in self-employment. So if you receive a pension, that's not counted against the earnings limit. You know, if you retire, you're just looking at wages only. Same thing with the $46,000. That's not counted if you receive a pension. The only thing that's counted towards that earnings limit is actual wages or self-employment. Okay, now this is kind of a little example here. Let's just say, I'm going to call her Jane. Let's say Jane retired. She's under full retirement age. She retires, and she's entitled to about $1,000 a month in benefits, which would be $12,000 for the year. If she worked and earned $27,640, that means she's $10,000 over that $17,640 limit during the year. But Social Security withhold $1 for every $2, so if you divide that, then she's actually over $5,000, okay? She's over $5,000. She still will be entitled to, because what we do, we take that $5,000 away, so she's still going to receive $7,000 out of that $12,000 for the year. You know, even if she's over, she's still going to receive some, okay? When you reach full retirement age, let's just say this is Fred. Fred turned 66. He's going to turn 66 August of 2019. He's entitled to $2,000 a month. If he worked and earned, he's going to think he's going to earn $84,000 for this year. Okay, we're only going to count the months before his full retirement. So the only thing that's going to be counted is from January to the end of July. Since he turned 66 August 19, we're not going to count anything from August 19th on because he's full retirement. So there is no earnings limit for him. So if he's going to earn about $49,000 within that January from July, then this is the only thing that's going to be counted towards the earnings limit. So in this situation, we're looking at $46,920. If you subtract that from $49,000, he's going to be over $2,080, but it's 1 for every 3. So since it's 1 for every 3, when you divide that, it's actually going to be $693 that he's over, okay? So in this situation, he would still get his benefits from January to the end of July, but it's going to be reduced just for that 1 month. It'll be reduced. Okay. Starting in August, he will actually receive the full amount of the $2,000 because he has no earnings limit at that time. Okay. Social Security pays survivor spouse benefits to those who are financially dependent on the worker because they have no Social Security benefits or a small amount of their own. Now, there are spouses that work very little, he or she, and if you have a spouse that makes more money than you, let's just say he gets $1,000, okay, but you only get $400 on yours, then you're entitled to half if you're at your full retirement age. So you're entitled to at least $500 of his. What they do, they take the additional amount, and that additional amount is added to your record to take you up to the $500, okay? So you are entitled, but you have to have less on your own than you're entitled to as a spouse in order to collect on a spouse record, okay? Now, if you receive Ohio Public Employees Retirement, state teachers, school employees, Ohio Police and Firemen, Silver Service, then you are actually reduced from the government pension offset. Is anyone familiar with the government pension offset at all? Yeah, now what that is that if you receive a pension, 2/3 of your gross pension is calculated. That amount reduces whatever you're entitled to on Social Security. So unfortunately, there's a lot of spouses who will be totally offset that wouldn't even be entitled if they receive a government pension. It just depends. You know, each person is different. And they've been fighting that for quite a while, but they still haven't done anything. But that can draw a big dumper. And so they have a lot of lobbying going on that. So if anybody is affected with that, if you have questions later, you can ask me about that. Okay, spouse benefits. Benefits is 50% of the worker's unreduced benefit at their full retirement age. So if you have a worker who retired at 62, let's just say he's receiving $1,000 because he has a reduced benefit, but his full primary insurance amount is $1,500. Well, the spouse is entitled to half of that $1,500, not the reduced amount, but the primary insurance amount at her full retirement age, okay, or his full retirement age. If spouse-owned benefits is less than 50% of the workers, the benefits is combined. Again, like I said, if a spouse is entitled to 4 on hers, but she's entitled to 5 on his, then they take that additional amount and combine it on hers to take her up to the 500 amount. And with the benefits that she received does not reduce his or her benefit. So if she receives a spouse benefits or he receives a spouse benefits, it does not reduce the other spouse at all because it's paid out of the family max. Dependent benefits do not affect the wage earner either. So there's a family max payable. The worker works and pays into the system. He's paid out of the family max. Whatever's left over is paid to any dependent children or a spouse. Okay, it is not taken away from that particular person. There is a maximum that can be payable based on the family max. Okay, now if a spouse collects benefits before retirement age, amount is reduced. Full retirement age of 66, a spouse benefits at age 65, they're looking at probably about 46% instead of the 50%. 64, they're looking at about 42%. At age 63, they're looking at probably about 37.5%. At age 62, they're looking at probably about 35%. Now, the exception is if you have a child in your care under 16 of the worker or a disabled adult child, then you can receive the full 50% regardless of your age. Doesn't matter how old you are because you're filing as a mother or a father, either or, okay? So that's definitely good to know. Benefits for divorced spouses. If you are divorced and your marriage lasted at least 10 years before divorce or ended in death, you can receive benefits on your ex-spouse record even if he or she is remarried. So if he or she is remarried and you had that 10-year duration of marriage for divorce and it benefit you, you can still receive on a divorced spouse. It does not affect the divorced spouse. It does not affect the current spouse at all because everything is paid. The current spouse is paid in the family max. Divorced spouse is paid outside the family max. So it will not affect it at all as long as you reach the marriage duration. Okay. If you were married for less than 10 years and the marriage ended in death, you still qualify. Okay. The qualifications are if you are unmarried yourself, okay? So you can't file on an ex-spouse if you are unmarried, unless the marriage, we remarried after the age of 60. That's the only exception. Your ex-spouse is entitled to Social Security child disability benefits, and the benefit you're entitled to receive is based on your own work and less than the benefit you receive on his work. So in other words, this is the same thing. You have to still have less on your own record to qualify for the divorced spouse record, okay? But the thing is that you can qualify for that. Okay, so Fred and Alice both paid FICA. Fred received $1,600 Social Security benefits at full retirement. This is just an example. Alice received $1,000 Social Security benefits at full retirement. The spouse benefit rate is $800, okay? Alice cannot get benefits because her own Social Security benefits is greater, and the law recognized Alice is not a dependent. So because Alice's primary insurance amount is $1,000, she's only entitled to $800 on his record. She receiving more on her own record than she would qualify on his. So she would not qualify on that record. Okay, in order for you to qualify on a spouse record, you have to receive less. Okay, so if her benefit amount was $600 or $700, then she can get the additional $100 on her record. Okay, now if you lose, this is survivor benefits, if you lose your soulmate, you can get reduced benefits as early as age 60 if you're filing as a widow. You can get reduced benefits or early benefits at 50 if you are disabled. Between 50 and 59, if you become disabled, then you could qualify for disabled widows benefits, but it's a disability claim. You still have to file for disability like you normally do. And it takes anywhere from 4 to 6 months for a decision for disability, but you do have that option to file for disabled widow benefits between age of 50 and 59. However, there is a prescribed period that you have to file in between. When a husband passes away, it's like a 7-year, or wife, there's a 7-year prescribed period that you have to file, and you have to be between age 50 and 59 and unmarried, okay? Also, if you have children that's unmarried and age 18 or 19 still in high school, again, the children have to be in high school in order to qualify for dependent child benefits. Once they graduate from high school, they're no longer entitled, unless they're entitled up to 18. If they graduate earlier than 18, they can get it up until 18. Now, if they graduate and they're 18, they're no longer entitled. If they're still in high school, they can get dependent benefits for up to 19 and 2 months. They have to be in high school in order to get that. Now, if you're disabled or you have a child that's disabled, again, before the age of 22, they also can be entitled to benefits. You know, regardless of their age, if they were disabled before the age of 22 and that's proven, they can still get benefits from, as a survivor, from a surviving parent. Okay? $255 lump sum death benefit. That's only payable to the surviving spouse or a minor or disabled adult child. It's not payable to anyone else. That's it, adult children, no. It's not payable to any other relative, just a surviving spouse or a disabled or minor child. Okay, a surviving spouse benefits. If you're, you get about 82.5 to 100% between the age of 62 and 67, okay? 71.5% to 82.5% at age 60, 62. Now, if you file for widow's benefits at age 60 or disabled widow's benefits, the max you can get is 71.5% of the insurer's primary insurance amount. Now, if you wait until full retirement age and the person retired at full retirement age or they passed away, then the wife is entitled to 100% of that benefit. Okay. But in order for her to be entitled to 100% of the benefit, then the worker would have to retire at full retirement. If they retired before full retirement, then the most she can get is 82, or he can get 82.5% of that benefit. Okay, with survivor benefits, widows may switch from one benefit to another depending on what is most financial advantage. So basically what this means, if you were married and you remarried and your first husband passed away, okay, and you remarried again, but you're no longer married, you can actually switch, and you say you're receiving spouse benefits or even widow's benefits on a second husband. You can switch to that first husband or wife if it's going to benefit you, okay? If you're no longer married, you actually can switch 2, 3, 4, 5 times, whichever one is the higher for you, you can switch. But you can't be married at the time unless you remarry over the age of 60. So it is possible that you can switch from one husband to another deceased husband. But you do have, again, you have to have the duration of marriage in order to do that. Filing for benefits. Internet, telephone, office. Right now, they're pushing that you file on the online internet because it's faster. Always super crowded, okay? If you file online, then it goes directly to an internet cadre unit. They get your application, they go through it and process it. They contact you if they need any more information, but internet filing is always a lot faster. Telephone. You can call and make an appointment. We can do phone appointments and set appointments for you to come in to bring documentation if you need that. But a lot of people like telephone, and a lot of people like to talk one-on-one to a person. You know, you can do that by telephone. You can do that by office. If you do decide to file in the office, you definitely want to make an appointment. You can come in as a walk-in, but if you come in as a walk-in, it's just come as you, they serve you as you come. And you could be there for hours. So you definitely want to make an appointment unless you know. Some widows, or if they come in, their husband passed away or spouse passed away, then they need benefits right away. Then they'll come in as a walk-in, and we definitely try to accommodate them if they come in as a walk-in. The Social Security field offices are open Monday, Tuesday, 9 a.m. to 4, Wednesday, 9 a.m. to noon, Thursday and Friday, 9 a.m. to 4 p.m., except for federal holidays. Social Security Teleservice Center is open from 7 to 7 Monday through Friday, except for federal holidays. The 800 number, that's a national number, so you can get anyone, anywhere in the nation, you can get anyone if you call them. But what they try to do, if you need an appointment, they always try to schedule you with your local Social Security office based on your zip code. You can always suggest another office, because if you decide, I don't want to go downtown, I'd rather go to the office on the east side, you can suggest that, and they'll try to see if they can find a schedule for you. Okay, Medicare. Let's touch on Medicare a little bit. If you're 65 or older, you can qualify for Medicare. For disability people who's disabled, there is a 24-month waiting period for them to be entitled for Medicare based on their month of entitlement, unless they are diagnosed with ALS, which is the Lou Gehrig's disease. There's no waiting period for that at all. You're entitled right away. End-stage renal disease, if you have kidney dialysis, you can qualify for Medicare also, regardless of what your age. It doesn't matter what your age is, you can qualify if you're insured. Also, if you're not insured and your spouse is insured, you can qualify on your spouse for end-stage renal for Medicare also. Sometimes children can qualify on a parent's insurance record also for that. Medicare qualified government employees, that's MQGE, for people who did not pay into Social Security, like civil service workers or state workers. If they didn't pay into Social Security, but they paid into Medicare, then they still can qualify for Medicare under what they call the Medicare qualified government employment. They may not qualify for monetary benefits, but you still can qualify for the Medicare. Part A of Medicare, that's the hospital insurance. Social Security will take your information to enroll you in Part A. Part B is the supplemental. That's for your medical. Social Security does enroll you in Part B. Now, to enroll for Part C, Social Security does not enroll you for that. You need to go straight through Medicare for that. That's a Medicare Advantage plan, and you cannot enroll through Social Security. Part D is the prescription plan. Again, you cannot enroll through Social Security for that. You would have to go straight through Medicare for that. Part A, hospital insurance, covers most inpatient hospital expenses. There's no monthly premium for mostly all Americans. That's if you're insured with Social Security, then you have no monthly premiums for that. That's free. At age 65, you can qualify for Part A of Medicare, even if you're still working. The only thing about if you're still working, you want to make sure you don't have an HSA plan, because that could affect it. Okay. Part B of Medicare, this is the 2018. The 2019 rate is $135.50 a month for Part B of Medicare. Premium is deducted. from your benefits. If you're receiving benefits, they do automatically take that out of your monthly benefits. We have no control over that. Now, if you're not receiving benefits, then CMS normally bill you quarterly, on a quarterly basis. You do have the option to do easy pay and have that taken out of your monthly or your checking or savings account if you wanted to do that. Higher income beneficiaries may pay more. There's something called income-related monthly adjustment amount, IRMA. I don't know if you all ever heard of that, but the more you make, there's a possibility that you can pay a higher Medicare premium than $135.50. Okay, and I think there's a slide on that too, and we'll get to that. Okay. Part C and Part D is purchased through private companies. That's why you would want to go through Medicare, or there's another OSHIP you can go through to get the best rates for that. We don't handle any of the Medigap or Medicare Advantage, but you do want to do your homework to see which one would benefit you the most. Okay, let's see. Okay, now you may refuse Part B if you're covered up under a spouse group health plan. So in other words, if you are retired and you're 65, you can take your Part A if you've qualified for free Part A, because it's not going to hurt anything if you take it. Now, for Part B of Medicare, if you have a husband or wife and they're working full-time, you're covered under their employer, you do not have to take Part B and you will not be penalized. As long as they're covered under a current employer and they're working full-time and there's more than 20 employees in that company, you are not required to take that as long as you're covered. Okay? You can actually apply for Medicare during a special enrollment period. Now, I'm going to go over IEP real quick. Initial enrollment period would be 3 months before your 65th birthday, 3 months after your 65th birthday. Okay, and if you are not insured under a current employer or retirement insurance, then you have the option to take your Medicare during your initial enrollment period. If you take it 3 months before your 65th birthday, then it will start the month you turn 65. If you take that a month or so after, then it's going to start later. Okay. And again, like I said, if you're covered under a spouse with active employment, you're going to be rolling under special enrollment. Special enrollment means that you have an 8-month period to enroll after that after your employer insurance stops. So if your wife or your husband is working and then they decide to retire and you were covered under their employer insurance, when that employment stops, or when that Medicare or that pension plan or the coverage for their medical stop, you have an 8-month period to file for Medicare. As long as you do that within that 8-month period, you're not penalized. Okay. There's a possible 10% penalty per year for every year of delay enrollment. That's only if you don't apply, if you're within that 8-month for the special enrollment period. Okay, and this right here just tells you how to take advantage of the SEP. If you already have Medicare Part A, you cannot use online for the Part B of Medicare. If you're already in the system, it won't accept it. So you can call Medicare, or you can pull up Medicare online, and Medicare applications online, and then you're going to ask for the L564. That form your employer would complete to verify you had coverage under a spouse insurance or your own insurance at 65 in order for you to file under the special enrollment period. There's also something called a CMS 40B. Again, you can get that on Social Security website and Medicare website. That's when you're filing for Part B. So you're going to need to submit both of those forms together if you're filing for Medicare after age 65 because you were covered up under a spouse employee insurance or your own insurance. And you don't want to wait. You want to, again, at least 3 months in advance. The reason why you don't want to wait is because you want to give time for your employer to complete the forms and turn that in so you don't have any gap or any interruptions in your medical coverage. Okay, this right here is a chart, and it's kind of confusing, but this is a chart that shows you under special enrollment period that, and I can individually, go over that with someone if they want to see more of this, but it basically shows you if you file your month of entitlement, and it shows you when you're covered. Again, this chart is a little confusing, but right here, if you need, to find out about this, definitely see me afterwards, and I will go over this chart with you. Okay, This is the IRMA, again, I was telling you about. People who work and pay a certain amount into Social Security, and they file taxes, even if they file jointly. In other words, this is 2019. They're looking at your 2017 tax return. So if you have a combined tax return, more for you and your wife, more than $170,000, then you will be subject to what they call the income-related monthly adjustment amount. So instead of your Medicare being $135, it can go all the way up to more than that, $280-something. But you do have the option to file what they call a life-changing event. You will have to pull up Form SSA 44, which is on our website. And if you have a death in the family, or if your wife passed away, husband passed away, divorce, any type of life-changing events, you can ask for a new initial determination, and we can adjust it and use a new year. So in other words, if they're using your 2017, but your 2018 was lower, you have a life-changing event, we can adjust that, okay? We can adjust that Medicare for you. Okay, again, if you enroll in Part A and you're still working, and you have an HSA, you cannot contribute to that HSA. So you want to make sure you're careful if you're still working and you file for Part A of Medicare while you're still working. You want to check with your HSA, because we don't really deal with that. But again, if you have Part A, before you file for Part A, you want to make sure you check with your HSA to see if you, qualify, because again, you can be penalized with HSA. And again, even if entitlement to Medicare, you may withdraw funds from HSA to pay authorized expenses. So they'll let you withdraw, but you can't contribute anymore into the HSA. Okay, now federal retirement, and a lot of you probably qualify for this. Some FEHB plans, you don't have to enroll in Part B, but you want to check with them to see who can enroll and who cannot enroll. A lot of civil service workers, they don't have to enroll in Part B. It's not required, but it may benefit you to enroll in Part B. So you definitely want to check with them to see what's the best option for you. Okay, if you want to enroll in Medicare after IEP or CP, you must wait for general enrollment. Okay, so if you missed all your enrollments, there is a general enrollment period, which is January, February, and March of the year. If you enroll in your Medicare during that period of time, your Medicare does not start until July of that year. Okay, and there's a possibility you can have a 10% penalty. And that's only if you was not covered under any insurances, but you missed all your initial enrollment periods or your special enrollment period. Okay. Okay, now, Social Security cards, your Medicare cards, they removed your Social Security numbers off of there. They used to have your Social Security numbers on there, but because of the legislation for 2015, they removed all that because of the identity theft. Now you have a whole bunch of different 11 characters. It's just totally different now than it was. It's an NBI number. Everyone who has Social Security Medicare, they should have their new cards by now. You know, if you don't have your new card, you definitely want to call Social Security to find out why you don't have it. By April 29, 2019, all people with Medicare will receive Medicare cards with the new numbers, okay? So if you don't have it, call Social Security to find out why you don't have that. Okay, 1-800-MEDICARE, the website is on here. If you want to find out more about your Medicare, Part C and D especially. Again, if you want to write this down, these people, OSHA, Ohio Senior Health Insurance information, they have really, really good information to help you with the other parts of Medicare. The Part C and the Part D, they can help you decide which one, because there's a lot of different plans. So you want to do your research, you want to make sure which plan is best for you. Okay, because each person is different. Depending on how much medication you take, you may not need one plan over the other plan. Okay, signing up for my SSA account. A lot of you have it already. If you don't, you want to go online and sign that up. Right, if you create an account now, they're going to ask you several security questions, a lot of security questions. They're going to ask you questions about way back when you were maybe 18, you don't even remember. Another thing you could do, you can get an activation code, but in order to do that, you do have to visit Social Security office to get an activation code. With the activation code, you can get in there a lot easier than just going straight into the website. But you shouldn't have a problem. But if there is a problem, you do have the option to get the activation code from Social Security. Okay, now this is just a little slide telling you if you go to socialsecurity.gov My Account, you want to select the sign in to create your account. You want to provide some personal information to verify your identity. And again, a lot of the personal information, it does go back to what type of car you had back in 1970. You have to remember that information. You want to choose a username, password to create the account. The account is secure. They're really beefing up on it. Now, that's why they ask you all these hard security questions, because they want to make sure that it's secure. No one can break into your account and get your information. Okay, some of the things that you can do online if you're not receiving benefits. You can request a replacement Social Security card if you meet requirements. Now, in Ohio, you can't really do it. You won't get the actual card, but you can get an application. You can check the status of your application or appeal. You can get benefit verification letters, proof that you are not getting benefits. You can get your Social Security statement to review, which is really good. Estimate your future retirement, disability, survivors benefits. Your earnings once a year to verify the amount. You want to make sure that your earnings is posted correctly. Then you want to always go in periodically and check your account to make sure everything looks okay. And you can get estimate Social Security, Medicare taxes that you paid into the system. Okay. And this right here is if you are receiving benefits, it's only certain things that you can do. Again, they have request placement with Social Security card. In Ohio, you can't do that yet. You can get a benefit verification or proof of that you are getting benefits if you're receiving right now. You can check your benefit and payment information and your earnings record. You can change your address and your phone number online. Start or change direct deposit of your benefit payment. Request a placement Medicare card online. And you can get a replacement 1099 or 1042S for tax purposes online also. Okay, now the two Social Security Trust Fund is the Old Age and Survivors Insurance, the Disability Insurance. The trust funds has reached the brink of depletion of excess reserve in the past, but Congress made substantial modification to avoid this. So right now, as it stands, that we have up until 2000 or 2034 to receive benefits. It's pretty set in stone, okay? Even if legislation changes are not made before 2034, the trust fund will still be available, 79% for each benefit due. So right now they're telling us we should feel comfortable at least to 2034 that the benefit is going to be there when we need it. Okay, so it looks like we're at the questions and answers. If anybody have any general questions that they want to ask.
We are going to ask you to use the microphone to ask your questions. Otherwise, as we record, it won't be available for the other folks to hear, okay?
Hi. Two questions. First of all, so they will calculate it for 35 years straight, not
Right.
past 5 years, because
No, it's consecutive. It doesn't matter. They take your highest years. So if you made more in 2000 than you did in 2007, they're gonna include that 2000. So they take your highest years.
35 years. Okay, great. And another one, if you, after you get Social Security, if you're not working, but you receive rental income, is it considered as?
It's not. It's not. Rental income, anything unearned is not considered. You mean towards your earnings limit? Is that what you're talking about? Yes. The only thing towards your earnings limit would be wages or self-employment wages. That's it.
So if I retire at 62, I can receive like reduced pension and work 17,000 and plus rental income?
Yeah, as long as you're not over the 17,640 in wages or self-employment, you can still, your rental property, whatever you receive from that is not going to count unless you're working. If you're working, you're getting additional money. That's the only thing. But as long as it's not, you're not working, you're just getting rental property because you own property, that's not going to affect it. Yeah, that's only your work.
Now, another question. If I retire at 62, but my like pension 67 would be higher, and my husband is older than me, and he received very small pension, is he entitled to 50% of my 67 years old?
Yeah,
Or
yeah, he's
60?
entitled 50% of your primary insurance amount. You're right. If your full retirement age is not to 67, okay, but you retired at 62, you're getting reduced benefit.
Right.
But your husband could get 50% of your primary insurance amount if he's full retirement. He have to be full retirement in order to get
Yeah,
that.
he's older.
Okay, yeah.
So he can get, if I would get, for example,
Right.
2,067, he will get $1,000.
Yeah, and that's only if he's not receiving benefits on his own is higher than that.
Yes.
Uh-huh.
Thank you.
So just to let you all know, we are going to also have dates in August where you can have a one-on-one appointment with Lynette, and also Jeremy, I think, is coming too.
I might not be Jeremy, but it might
We
be,
hope-
yeah.
But someone else will be coming. So please be watching for that email. And this is just a plug. If you didn't register through the online registration, send me an email because I take the names off of that online registration and let you all know when the appointments are first, okay? So just let me know, okay? Next, my name is Michelle DeVito. Okay?
Just had two quick questions. My wife worked for the school. She's on SERS, but her amount's not going to equal half of mine. But I was wondering on the offset, let's say she would be eligible for $1,000 off of mine. If she had like $200 coming from SERS, would that be a dollar for dollar? In other words,
Right, now if she,
200 for them and 800 from Social Security.
so if she's getting 200 from SERS, 2/3 of her $200 offset whatever that
So
$1,000.
it's just 2/3 of it.
2/3 of it,
Okay,
right.
so if it was $300, she'd just be offset 200.
Yeah, somewhere around, yeah, that
Yeah,
2/3
in that
calculation.
ballpark, okay.
Yep.
That's the first question. Second question, she's eligible to take a lump sum for part of that.
Okay,
If she takes that before she starts drawing Social Security, there won't be any offset for that.
it will, because if she takes a lump sum, that's going to be included. It's going to be included. If she takes the plop, is that what you're talking about, the
Yep.
plop? Yeah, when we calculate that 2/3, it's the whole amount. That's before the plop. It's calculated before the plop. So even though she took the plop and she's going to get 200, if she did not take the plop and say she was going to get 400, we're going to take that 400 and do 2/3 of that 400.
Okay, so
Yeah,
that wouldn't,
yeah.
okay, thanks.
Yeah.
Yeah, I also got a couple, I hope are quick questions, but I plan on retiring 3rd of January of,
Oh, wow.
2020. And I will get a cash payout for my leave lump sum. Does that count as income for Social Security for now?
It may. It depends on when you're going to get that. Now, the thing that you can do, if that lump sum is based on a prior year, then you probably want to get some documentation, have it ready, just in case you get a letter from Payment Center saying, we see you earned such and such amount, and it wasn't really work, it was something that they owe you from the prior year. You want to have that information, bring that to Social Security, because there's something called a special wage input we can put in the system to show.
Okay. And my wife will be drawing Social Security on me because she'll be turning 62.
Okay.
But now if something happens to me, say 4 years from now, then she'll switch over to start getting based on
Yeah, it'd be
survivors,
automatic.
completely different, yeah.
Yeah, if she's already on as a spouse, and you pass away, then she'll automatically be converted to the widow's benefits if she's
Okay.
already active. Uh-huh.
I'm a military retiree, turned 65, enrolled for Medicare. I'm a disabled vet, and I'm seen by the VA for my medical and prescriptions. What is my obligation for Part B Medicare?
If you covered under VA, then you have the option to refuse Part B if you wanted to do that. You don't have to take Part B unless you want to take it. But people that's covered under the VA, majority of the time, they refuse Part B because VA cover everything for them.
Yep. Okay, thank you.
Yeah.
Are there any changes in the benefits? There's phased retirement where you kind of, instead of a hard leave, you working part-time at your job and still getting retirement benefits.
Yeah, you
is
can
that
do that.
affected?
Yeah, you can, as long as you're up under that limit. You mean at what age are you talking about? It depends on what age you are.
Okay, I guess it would be, if I do it, we'll make it easy, at 67.
Oh, you're fine. At 67, you can make whatever you want. It doesn't matter.
Okay.
Yeah, your full retirement age, you can make whatever you want. You can make $100,000 and still collect your Social Security.
Okay, so so there still would be a penalty if I do this phased retirement starting at 63, 64.
Well, yeah, if you're 63, then you are subject to that limit. You are subject to that earnings limit.
Okay.
Yeah.
Thanks.
Yeah.
It takes a couple minutes to digest all of this. It's a lot of information, isn't it?
A lot of information.
My question is going to be relative to my wife. I'm already receiving Social Security benefits.
Okay.
I have FERS
Okay.
for medical insurance. I've deferred Part B, but I
Right.
took Part A.
Okay.
If I understood on an earlier slide, you indicated that you can defer Part A and B if you choose, or she could, when she becomes eligible this year. She could defer Part A and B until I lose that coverage or we drop that coverage.
Yeah, as long as she's covered under employee group health plan based on current work, you don't necessarily have to enroll for A or B. You can enroll in A because it won't hurt if you do, unless you have an HSA plan through employer. That's the only reason. Yeah, so if you're covered under employee group health plan coverage, it's not mandatory that you take A or B.
Okay, what advantage is there to not taking A? Because my understanding of that is it becomes secondary to your primary insurance, which
Yeah, it'd be a
hers.
secondary. It's really your choice. It's your choice. You can take A because it won't hurt if you do or if you don't, as long as you're covered under that employee group health plan coverage. So you can take A. The only thing, like I said, again, if you take A and you're working and you have that HSA, it'll affect that. That's it. But yeah, you definitely can take it at 65 if you're still working and it will not hurt anything.
Okay, thank you.
Yep.
Any more questions? So as I said at the beginning, please know that we're recording it. It'll be available on the MWR webpage. I think that's very important, particularly with this topic, because it's a topic you need to think about, process, look at your finances, look at all those different elements, and then be able to go back and get that information again, because it's very complicated, and there's some things that are time sensitive. I will tell you that the way we work the appointments is we'll put it on the scheduler on the intranet. It will be 15-minute blocks of time. When you decide that you want to come and have an appointment with Lynette, you must have your online account set up, okay? So you have to have that Social Security online account set up. And then when I send the email out, I'm just going to ask you to verify that you can get in, because sometimes those passwords we set them up and we remember them perfectly when we set them up. And then 3 months later, when we go back to try and use them, all of our regular passwords just don't seem to work. So I'll send out some reminders, because it takes about, it takes about 24 hours for it to reset if you
Yeah,
ask for a new
yeah,
password. But then, you will have it, you'll be ready, you can come in. And we'll have, again, as I said, Lynette there. You'll pull up your accounts. She can walk you through the different questions you have, because as I said, sometimes you go home and all of a sudden there's something that's pivotal that maybe you didn't have the information and you need to look at, especially if you're looking for someone other than yourself. You may not have that information. I will tell you that when you set your online account up, it asked me for the year that I bought a VW Beetle and what color it was.
Yeah.
Now, I don't remember. I remember it was red. So don't be thrown by that. The questions are sometimes pretty detailed, and you have a little bit of time to go look it up. So kind of think about, reflect on your past life. They do look mostly for those items which you needed a
Right.
loan or you registered
Yeah,
for. So, okay.
Uh-huh.
So that's kind of what they're looking for. And if you purchased a home. So just kind of have that in the back of your mind. I would say any questions? One last question in the back?
If you end up retiring at full retirement age and your spouse gets your 50%, but then your spouse passes away after that, will you, and she would not have gotten anything pretty much because she's been stay at home for most of the time,
Okay.
will you then get nothing after she passes away?
Yeah, because the benefit that she receives is paid out of your family max. It's not taken away from yours at all.
So I would just receive my normal.
Exactly. Yeah.
Okay, so if you would just join with me in thanking Lynette and making her feel welcome so we are sure she comes back to visit us. Thank you all for coming, and as I said, the slides and all of the information will be available on the MWR webpage in 3 or 4 days, okay? Thank you.